Okay, hello everyone. I'm headed somewhere right now, but update y'all because I know I posted that ophthalmic assistant position or ophthalmic assistant job video, like day in my life, and then never came back. That is because I actually recorded more while I was working there, and then I just stopped recording. Don't ask me why. Before anything serious starts, getting really on the floor and stuff. So I decided, you know what, it's time. Like, it's time to really just get my life together, stop being afraid to go back to school, because I really just did not want to go back to school. Trying to get myself together and stop being afraid of basically succeeding. So I actually applied before. I applied for a patient care tech position at a hospital, and she was like, well, you need to have like a CNA schooling. You have to have either your like second semester or something in nursing school. And I was like, okay, well, I don't have any of that. So she was like, well, go ahead and apply at long way. I can't get over there. Oh, yes, I can. She was like, go ahead and apply for like an admin position in the hospital, and then once you have your certifications, you can just let me know and you can transfer over. Emailed her and I was like, hey, I'm gonna do this, but I'm gonna go straight into it. And she was like, okay, just let me know. So I immediately enrolled in a patient care tech course. So I'm done with my CNA coursework, but I have my phlebotomy and EKG coursework due. So today starts phlebotomy. And I'm super excited. I'm pulling up now. I'm excited, but I'm nervous because I'm excited and nervous at the same time because I'm terrified of needles. So this is gonna be an experience. I'm excited because I really need to get over this phobia of needles that I have. So let me fix this now. I had to have it back in order for it to stay right. But me having this phobia has to end. It just has to end. It's over. I'm done with it. So my phlebotomy is today. I did not go to work. And skills for CNA is this Monday and Tuesday. EKG is Wednesday. I'm not gonna go to work again. And then Saturday and Sunday again is the last of skills for CNA. I am so excited. I'm really, really excited about this. And then I really want to be in pediatrics. I know a lot of people are afraid of pediatrics, but I'm not. I'm excited and I'm ready to do it. So I really get to know when people ramble and talk too much on their videos. So no lie. So I'm not gonna ramble too much. It's been 8 minutes. So I will see you guys when I am done. Alright, so we're back home. First day. We got out around 3:30, but I stopped to get some food for dinner tonight. It was cute. But it was good, very informational. We didn't do any skills or practicing on each other today, but we are tomorrow. So that should be interesting, knowing my fear. But I let everybody know, hey, I have a phobia. We're gonna work through this together. So tomorrow's the day. I will update y'all again with how I do.
We could sit down too. We don't have to stare at you.
No, it's okay.
Do you want us to?
Can I open?
Yeah,
should I
don't worry.
put my
I
gloves
think
on
she
before I open
yeah.
the alcohol?
Yeah, just put on your gloves. That should be okay.
You got this. And then you can stick me after. Depending on how I do.
Which one is it?
Say a prayer.
I prayed about it last night.
Talk to
Not
Jesus.
yet. You've asked me to.
Philippians 4 verse 13. You can do all things through Christ. Girl.
Oh, I see.
Yes,
So
Lord.
you don't
All
actually
things
need to
through
request
Christ who
it.
strengthens me.
Oh, well,
That's
then
one of
I
my
can do
favorite
Yeah.
verses.
Oh, okay.
that. Okay, awesome.
That's just for people who want a free one, which I've accidentally accepted those.
Just remember, I'm going into labor, so
Oh man!
you never know. You might be the one sticking me that day.
Okay.
Does that feel okay?
Feels good.
You're okay. So I see, I can kind of see that one.
It's a
Right
little
there.
tricky. Yeah, it's right there in the middle. Bounce your finger right there. Do you feel it?
Yep, I feel like a little circle
It's
almost.
going straight.
It's going straight. It's not on
So
an angle.
Right where you see right there? Right here it goes.
Yes.
Straight.
Yep, now I see it.
Yeah, so you're going to follow exactly that angle.
Okay.
Alright. So now that you've chosen your most accessible site, you can go ahead and cleanse it.
All right. Just gonna clean it.
Okay.
Alright, so now that
Wait
the
for
side
it
is
to
cleansed,
dry.
you can go ahead and just start dealing with your needle. If you need to look away, just go ahead and look away, alright?
Okay.
You can look at my baby.
If you want. If you want to like block it with paper so that you don't see anything. Or, okay.
You wanna hold my baby? No. You can rub. She's kicking right now because you know you're crying, so you might as well.
She's like,
Just keep breathing, okay? Just keep breathing. You'll be okay.
It'll be over in just a second.
Yeah, it's alright if tears come. That's gonna help you feel better.
Okay. All right.
Just go ahead. Okay. Here we go.
You got it.
Just keep breathing. Don't hold your breath, alright?
1,
Okay.
2, 3.
Okay.
Alright, so get you have a flash.
Okay.
So now you can go ahead and take the tourniquet off immediately.
you're good.
So now start pulling back on your syringe.
Well done. I feel like I'm the one
How
in
did it
labor
feel?
right now.
Did it hurt?
I'm like, hey.
I don't have the fear of like it happening. I just have the fear of it starting.
Okay.
That's what messes me. Me.
I'm already taking the blood out.
Okay.
Just keep breathing, alright?
Oh, there's 2 pregnant women. You want to try that, lady, too?
Alright, that should be good enough. So now hold that needle still. Just pause. Hold it over. Pull all the way out. Push down.
Ooh, good job.
Great work.
Okay.
Good job.
You did it.
You did great.
I'm a sympathy cry.
It's hurt. Don't worry. I don't think it hurt that bad. Alright? It's just scary. So don't think you hurt her.
No, it didn't hurt.
Oh, good.
I don't think you hurt her. Keep in mind, if somebody cries like that, I mean,
I don't
what
want to
you're
cry.
doing for them
Yeah.
is helping them a lot. Okay? So even though it's sad in that moment, even though it's kind of hard to put them in pain, you're saving them, maybe even keeping them alive for them.
Good. How are you?
I'm good, thank you. My name is Demi. I'll be your phlebotomist today. I'm gonna draw your blood here.
Okay.
Can I get your full name, date of birth?
Teresa Zadie, 7/12/81.
Thank you, ma'am.
I think I forgot to get consent from you when I did yours.
Hey, listen, that's all right. And then, bam. Thank you. Do you have a preferred arm you'd like to use?
Whichever one you feel. Probably this one. Probably
right.
the left.
Select this up here towards you here. Alrighty, now first I'm gonna apply this just to get a good vein here. It may be a little bit tight, but it should not hurt. Now these look tricky. So are her veins just like thin or?
Thin and superficial.
Okay.
So they're close to the surface and they're thin. So they're deceiving. You may think that they may be viable, but you actually have to be able to feel it. What I think is none of these are going to work.
Right.
The only one that's going to work is somewhere hidden underneath.
Okay.
Okay. Which side do they usually do on you?
Usually the left. But it's hard because sometimes they're both pretty tricky.
Okay. Let's see.
Oh, mine?
This is a hard one.
Yeah, I'm not feeling anything.
You want to try the other arm? This one probably would be better. Oh, yeah.
Release this here. I'm gonna
It's
try
starting to
your.
go away. I'm so sorry. If I can help you, I will.
Oh yeah.
I did the same. I was like, girl, that didn't pick her.
You can make the tourniquet a little tighter too if you
Okay.
want.
You tried these on before?
I haven't, but I was looking at you good.
Oh, you're doing great.
Thank you. Really good.
A good gauge that patients do when they're watching you, when you're first doing your first procedures, is how proficient are you with tying the tourniquet on. If you do it quickly and confidently, then they relax because they're like, oh, this person knows what they're doing. So getting really good at tying the tourniquet is a really big thing for calming your patient down. Because once they see you go like, they're like, whoa, you know, then they chill out a little bit. From the way that her skin
Yeah, I'm not
moves,
feeling anything.
I feel like there might be one right here.
Okay.
Wow, yeah, but that's...
That might be the first hand patient.
I think there's one right here. But it's
Really?
a little bit hard. I'm almost
Yeah.
scared that's like a tendon. That would not be good to stick. Yeah, I think she
Okay.
might be the first hand.
Does this feel like it might be one right there?
You know
Is
what?
that skin?
No, that's a vein.
Okay.
Right, exactly right there. Great job.
Job.
Yeah.
Yeah.
It's very faint, but yeah, perfect.
Okay.
And that's hard to find with gloves.
So should I take this off again and then reapply it? 'Cause it's been a while.
We had to give you a challenge.
So how long if we take it off? How long do we leave it off? And then
A minute.
Okay. So a minute each time. Okay. I think I
After
still-
this, y'all will be good to go to lunch.
Oh, I don't even have a watch on.
And then we're gonna do one station, we're gonna start hands. The other station, we're just gonna keep doing these.
Okay.
And then y'all might actually be done with your skills requirement in one day.
Okay.
First time it's ever happened.
Oh. Girl, like, right? I love it.
Reapply this back on your arm.
Yeah, it's my backup plan if I don't graduate. College. What am I studying for? So I'm getting a degree in biology when I should graduate. Then I'll get a job as a phlebotomist until I graduate.
You're getting a bio degree?
Huh?
You're doing bio?
Yeah.
That made his ears perk up.
Right?
Where do you go to school?
UNC.
Oh, okay.
Yeah, this is just my backup.
Yeah, I started in bio, but I switched to nursing. Once I got to OChem, I dipped 8 weeks in.
Yeah, OChem too was fun.
Oh, I can't imagine.
Oh, I touched it.
Just wipe it.
Okay.
You don't have to do the whole full spiral if you only touch it in one place. So now just make sure you let it dry. You've inspected everything. Perfect. Alright, so now you're gonna anchor about 2 inches away. Yeah, perfect. That's great. So try to move this index finger a little bit out of the way. Awesome. Alright. Now your sight's about right there, right?
It was like right in here. Maybe right there.
Okay, good. So you're gonna enter at 15 to 30 degrees. With confidence, push in. Alright, so we don't have a flash quite yet.
Mm-hmm.
But release your anchor hand very gently and try and pull back on your plunger. You might be in. Not yet. Try pushing a little bit further in. Is it okay?
Yeah. Oh, I didn't mean that.
Try it again.
Go further in. or like move it?
Try the pull.
Trying
Oh.
to pull it. You had to give
So
me
now
a
try
challenge,
go
girl.
a little bit further in. Right
You're
there.
not hurting me.
So
Okay.
now try pulling back. Okay, so we still don't have anything. Maybe you went through and through.
Okay.
So our first move, remember, is to just slowly start pulling back, but not so far to where it comes all the way out. So about right there. So now try your plunger again. Okay, so now we're going to pull back and then do one side and then push. If you feel resistance when you push, that means that you're pushing against the vessel.
Okay.
So now try it. No? Okay. So now pull back before you change your direction. And then try the other way. And now push. Saw kind of a pop.
I
Right
did too.
Tricky. Let's take this off just in case.
Oh, take it out.
Don't pull out yet.
Oh my god, I already went too
You're
far.
okay.
Did that
You
hurt?
didn't- you didn't
That
pull
hurt. I know. I
You
need to take it
pull
out.
all the way out. Don't worry. So I saw resistance, and you said that you felt it. Right? So
But I think I pulled it too far out. Is it too far out? I feel like it is.
Don't worry. Don't overthink. Okay.
Okay.
This doesn't hurt right now, does it?
She reacted.
So try to push a little bit further.
That doesn't hurt.
Okay.
And now try to pull back.
Pull back my needle.
The syringe. Sorry.
Or this one?
The plunger.
Oh, this.
Nothing. Okay, that's okay. Now try slowly pulling back. A little bit more. Right there. And now try your plunger again. Okay, that's all right. So go ahead and get your gauze.
Oh.
She's a tough stick.
Yeah, I don't
So
see
now hold
any
over
veins.
And pull out in one swift movement and press down.
All right, y'all. It was a day. It was a day. I got video of us doing the poking, and I am going to put myself on blast because I also got the video of them doing me, and I was crying. But I can say I didn't get video of me going again after lunch because that same lady, nobody got blood out of her. Not out of her hands, not out of her arms, nothing. Like, it was impossible to get her blood. And she said that when she goes to the doctor, that happens the same way. She gets poked a million times. So I didn't feel bad because then after lunch, I didn't record after lunch. I got blood twice. I did get blood out of her hand, I believe. Yeah, I don't think I recorded that, but I got blood out of her hand a little bit. I got blood out of her hand, and then I did the instructor. Nobody got blood from him. And then I did another girl, and I got a lot of blood out of her. Like, I filled her tube up. So, and we used a butterfly needle. That needle hurt so bad. Like, the syringe, like that type of needle was fine. But that butterfly needle, if I was recording and y'all would have seen my facial expression, I was like it was bad. But he said that we were the best class he's ever done, and we don't need a day 2 skills because we were all awesome. So we were all excited about that. So tomorrow we're actually going to just do a Zoom class for like a few hours, and then just finish through our modules and coursework online. But other than that, we're good to go for phlebotomy. Pretty much just going to get that certification, and then on Monday and Tuesday, I have my skills for my CNA. I'll do some recording of that one, and then my EKG, I'll do recording for that one, and then the rest of my skills on this next weekend, the upcoming weekend. So I'm excited. I really legit want to just start applying for jobs now, but I'm going to be patient and wait. But y'all, I'm actually proud of myself. I'm proud of me. I'm proud of me, you know, because I did really good after the first time. I cried a little the second time, and then I just kind of like freaked out. But tears came out each time. But I think it was more so me just freaking out when the needle hits me. But it was great. I'm really proud of myself for volunteering to go. So I was like, I'll just do it again. I just want to go it again, just to really just get it. So I'm really proud of myself in that aspect, because I could have ran, but I didn't. So I forgot to do an intro this morning, but it's like 1:30 now. We are on day 1 of our CNA skills. It's going great. We did a partial bath. We did a hand hygiene. We did something else, but I cannot remember. And then, of course, like the orientation portion of it. It's going really good. I have a phone call or whatever with a hospital tomorrow. It's the hospital that I actually was trying to apply to like a month ago, and I needed this certification. So I emailed her and I was like, hey, I'm almost done. I was determined to finish this and get this going, and she was like, let's set up a phone call. And I was like, let's do that, you know. So I have that tomorrow. Today is the 24th. So pray for me. It's just going pretty good. So I have day 1, day 2 tomorrow, and then EKG on Wednesday, and then again I'm gonna go back to work Thursday and Friday, and then come back here Saturday and Sunday. So I'm literally not gonna have any off days for like a week and a half straight, honestly, something like that. But yeah, so we're gonna finish up day 1 of skills. She said that we'll probably get out around 3, but she really wanted us to have our break. I'm like, I could have just stayed in there. I was hungry, but I got some snacks, girl. But the food was good. So we're on our break now, and then we're gonna go back, and then we're gonna be done. It's gonna be it's like an hour left, hour and a half maybe left, and then be back here tomorrow. And then I'll have 3 days left. 3 days. I'm excited. I'm so excited. I am grateful. I just want to put that disclaimer. I am grateful for my job. I'm always grateful for any position that gives me an opportunity to work, you know. But when you know something is not for you, it's like, don't waste your time, don't waste their time, and just move along. I've tried to stay in a position where I knew it was not for me, and that's how you become like you're not happy. So I just want to do something that's going to make me happy, and I really want to be in pediatrics. I know that they're going to be most of the time sick outside of like a general, you know, scare of like a cold or something. I know that these babies will be sometimes terminally ill, and that is very heartbreaking because they're not getting that opportunity to live life to its fullest. But passing on in general is really, really sad. It's just, you know, the babies don't get a chance. So I just want to be there for them, to fight with them, to fight for them, and to do our best. And then if it leads to, you know, the end there, I want them to remember smiling faces and people who truly, truly care. So I know I will have to prepare my heart. I will have to prepare my mind for this, but I'm ready for it. I'm definitely ready for it, and I'm excited. Okay, so it's my turn to do my skills testing. So we're doing assisting the resident using the bedpan. So we had to get all of our supplies. This linen protector there. And there's the bedpan. So you roll the blanket down, check all your safety precautions, lifts in the bed, and then locking the wheels and the bed rails. I forgot to put the linen protector down first. And then Look at me, upside down. Oh my goodness. But I kept looking over at the instructor like, did she see it? Did she see it? And then, of course, you have to lift the bed to the Fowler's position and make sure that the resident is doing okay. And I'm like, what am I missing? I know I'm missing something. And I'm like, oh yeah, I have to wash my hands. Take the gloves off. And I wanted to keep them on to like half do it. And then she was like, no, take them off and do your proper hand hygiene. And then that's when I didn't need to put the gloves back on. So then you cover them up, give them the call light, the tissue, the hand wipes, and then you exit the room. Proper hand hygiene. And then you come back, proper hand hygiene. It was so many times where you had to wash your hands. It was insane. And, changing the gloves. And then we were kind of trying to recycle our gloves. So it was a hazard trying to put the gloves back on. And then you go back down to the supine position so that you can take the bedpan out. You have to stick your hand under there to make sure that the bedpan does not spill over. So that's, a job in itself. Pour that in the toilet. Anything below the neck to the toilet, anything above the neck, you can put in the sink. And I kept looking back because she was like knocking over my camera. Re-glove, and then you roll the linen protector. She was so sweet. I'm like, here I go. Like, what am I missing? I'm forgetting something. What is it? I roll it back up. Again, safety precautions. Locking the wheels, the bed, offering where they want the bed, the table. Wash your hands. Okay, so clearly it's another day. It's another day. We did day 2 of skills, and pretty much just hands-on. I don't think I recorded anything today though. I don't think so. But we did like bed making when the patient is in the bed with them, and we did changing the catheter. We did mouth care with and without dentures. I feel like we did something else today, but either way it goes, we did all of those. I have my EKG tomorrow, and then work, and then skills again on Saturday and Sunday. But I may be able to do just one more day of skills since I'm trying to knock some out tomorrow after I do my EKG, because I think I'm the only one that comes in for that one tomorrow. So hopefully I will be able to knock some of those out. The day is over. It's 3:41. We kind of stayed a little bit longer because we were in there talking or whatever. But great day. I'm excited. Oh yeah, the phone call. So I had the phone call today. She was like, I knew that name sounded familiar. I was like, girl, yes, it's me. It's me. But Jessica. Anyways, if you know, you know. We did, she was like, go ahead and apply. If they ask for your certifications, we'll get those later. But if you don't see anything that you want, I'm just gonna get your resume, send it off to different departments, see if anybody is needing anybody to do any interviews, and if so, I'm gonna let you know. So it's like I kind of got somebody on the inside, but I don't. So I'm excited about that. Again, it's pediatrics, and that's all I want right now. If I don't get to do pediatrics, then I want to go to women's health. As far as like, I don't necessarily know about labor and delivery, but like postpartum, I'm okay with. Just women's health in general, I'm okay with. And then if I don't get in women's health as a nurse, I would like to do drug rehab. I am obsessed with like rehabbing people off of drugs and stuff. I love. If you've never seen Intervention, watch it. It's really like, it's real. So those are my 3 like main specialties, and then we'll kind of go from there. I love cardiac as well, so I'm interested about the heart. So I guess top 4 maybe. But I'm almost done. Y'all got 3 more days. I'm gonna keep you updated. Alrighty, y'all. We're down to 2 more days left. We did EKG today. I didn't like get to be a patient just because we were kind of, it's 5:28. This is the this is the longest day we've had since starting the program. So we were having to fit like all of this knowledge, education, and skills in one day. So it took a while, but it was great. It was actually pretty fun. You have to learn the beats, the rates, and all that stuff. So it was really, really cool. If all else fails, I would probably be an EKG tech over phlebotomy, but I'm not. I'm doing patient care tech, and I'm gonna stick with that. But it was really cool. It was really, really, really cool. I thought about being a cardiac sonographer before nursing, not before nursing, but a while ago. So the heart is very, very interesting. So it was really cool today. It was really, really cool today. There's only 3 of us in this course, so it was we were able to get through it without having to repeat a lot of things. So that was really good. But I'm gonna go home and find something. I think I'm gonna have a salad. Yeah, I also got some some footage of it's so busy. I'm sorry, I keep looking out because 5 o'clock traffic, and I am not trying to deal with this. But I got a picture of the actual EKG machine like going, and then I got like a video of like all of the I forget what they were called, little clamps. I got a picture of them all over her. She requested I did not get her face, so I did not get her face. But it was a good class. It was a really good class. 2 more days of CNA skills on Saturday and Sunday, and then I am done. Okay, I'm gonna do a quick little update. I did not update during lunch because I was hungry, like I'm hungry right now. But we actually had a different instructor today. Well, she's been at the school, but I guess it was her weekend to come in, and she's so funny. She's so funny, but she does not play. Like, she wants you to know this stuff. So, the other one does too, but she's like, we couldn't just like leave when we wanted to leave. She was like, okay, we're gonna ask you questions, and you got to get these answers correct in order to leave. And I'm like, cool, let's do it. And I was like, oh Lord. But she asked us a couple questions. We were able to leave. But during the day, it was really good though. We got through, I think, like 6 skills today. I have 3 left, and then but we're gonna hopefully do those in the morning so that I can skill test out during lunch, and then I can get my certificates and I can be done. So I'm super excited about that. I'm gonna be sad to leave because this is actually a really, really awesome school. Like, y'all, once I finish it, I will like tell you the school, but I highly recommend it. It is in the DFW, Texas area. That's where I live. Highly, highly, highly recommend this school. It's really awesome. The people are absolutely amazing. But yeah, tomorrow is my last day. I get my certificates and hopefully get a job soon because I like my job. It's cool, whatever. I don't hate my job. I'm grateful for my job. I'm grateful for any opportunity that I receive, but I feel like it's time for me to actually walk in my purpose and stop deflecting. So it's time to be a big girl and put my big girl pennies on. But yeah, so tomorrow's last day. Super excited. I didn't record any skills today. I may record some skills tomorrow, but I'm for sure gonna like take my picture and do my farewell. So I will see y'all tomorrow. Okay, y'all, I'm done. Oh my gosh, I just got like makeup on it, but we're done. Certification is mine. The only thing is they only gave me one for the CNA portion of my program, and I did the full PCT, which is CNA, phlebotomy, and EKG. Ooh, this air conditioner got to blast, baby. Sorry if y'all hear that. So she's either gonna, because I really need those to update my profile for my job applications because they have to have supporting documents. But I'm gonna put that one on there because that one's for sure needed, and then the other ones was kind of like extra, but I got them anyways. So she gotta give me those, but I did my skills to test out. I did my paperwork. I did everything, and I'm done. I'm gonna go home. Well, actually, I have to go to the store, get a couple things, and then get some gas, and then go home. And I'm probably gonna take a nap. But I'm so excited. I'm gonna upload everything together because this has been a ride. All the stuff that's been going on, it's been a lot. From the first to today, I literally did all this in a month. I was like, we gotta get it going. So I am so excited to be done. I'm gonna miss them. Oh yeah, I was gonna tell y'all. So this is called Legacy Career Institute, and it is in like the Carrollton, North Dallas Carrollton area. I think it's gonna be technically called Carrollton, but absolutely amazing school. 100% recommend. That was like the only little flip, whatever you want to call it, like mess. I wouldn't even call it a mess up because it's like I got like the main thing, but I just need those other two certifications. But those are so easy. I live like 6-7 minutes down the street, so it's nothing for me to come get it. It's just the timing for me to come get it and me needing it. But other than that, like the instructors, the education, the knowledge of the instructors, the convenience, like having the online. The only thing I really wish they had evenings, because then I wouldn't have had to miss work. But other than that, highly recommend Legacy Career Institute. If you are in like the DFW North Dallas area, I would highly recommend this school because get you in, get you out, and great tuition pricing. Great tuition prices. I do it. But other than that, yes, she's done. I'm ready to get me a job and then go back to school and be a nurse. But we're gonna start with PCT. Thank y'all so much for watching this video. I know it's long and kind of all over the place at times, but we got through it. So I would say next time, but it might be another year. But it's not gonna be another year. It's not gonna be a year, y'all. I'm gonna give y'all some day in the lives. I'm actually going to be active on my YouTube channel. I'm actually gonna try. So until next time, I hope you enjoyed the video. Come back for the next one. I won't be gone a year this time. And yeah, yay me, yay you. Let's do this nursing thing. We need nurses now. So good luck on your nursing journey. I pray that you wish me good luck on mine. And yes, comment, subscribe, like the video, and let's do it.